हेलो अस्सलाम वालेकुम, दिस इज़ मी डॉक्टर जहांगीर एंड यू आर वाचिंग मी ऑन माय यूट्यूब चैनल। आज हम एक बहुत इम्पॉर्टेंट केस डिस्कस कर रहे हैं एंड दिस इज़ वेरी कॉमन। एवरी थर्ड एंड फोर्थ पेशेंट यू सी इन द ER and OPD is a patient of this. You can see over here this patient. This patient is, if you see, this is drowsy. The patient is drowsy and the patient is very much obese. Hypertensive or diabetic ischemic heart disease, but the patient is drowsy and she is sleeping while sitting. The patient is snoring at night. The patient is having morning headaches and the patient is having somnolence during the day. So this is a typical case of obesity hypoventilation syndrome. These two are closely related, the obesity hypoventilation syndrome and obstructive sleep apnea. In obesity hypoventilation syndrome and obstructive sleep apnea, the main difference is in obstructive sleep apnea, the patient is retaining the CO2 at night, while the day he washes that CO2. But in obesity hypoventilation syndrome, the patient cannot wash the CO2. Well, the mechanism is very easy. If you focus on the lungs of the patient, suppose this is the right lung, this is the heart, and this is the left lung. So over here we are having the diaphragm on both sides, of course. So what happens if the person is obese? So there is the fat accumulation outside the lung. So there is fats accumulation inside the below the diaphragm, above the diaphragm, that causes the lung parenchyma to be reduced. So the person cannot extend or inflate her lungs. If you cannot inflate your lungs, so what happens? There is, if this is the lung of a normal patient, so what happens when this inflates? The blood vessel in it dilates. When the blood vessel in it dilates, there is more blood coming and there is more washout of CO2. But in obese patient, what happens when the tidal volume is decreased? So the lung is not expanding. So what happens? There is less blood coming to the blood vessel and there is a less washout of CO2 and the CO2 is retained. So any disease apart from obesity, if it causes the lungs not to expand and causing the decreased tidal volume, so what happens? There will be retention of CO2. So what is the treatment? Treatment is CPAP. But if type 2 failure, then BiPAP. CPAP at night for obstructive sleep apnea syndrome, but for obesity hypoventilation syndrome, the answer is BiPAP. Regarding the BiPAP and CPAP, you can watch my video that already I have uploaded on my YouTube channel. Thanks for watching. This is a very interesting case and you will see a lot of patients in the ER. This is called Pickwickian syndrome. An obese patient sitting in this position and drowsy, you can think of obesity hypoventilation syndrome.